Hello class, this is Professor Hale. In this video, I am covering exam 2 of the reteaches on ABGs, fluid and electrolytes, and integumentary. I hope you like my T-Rex there. So here's a question that I had on the exam 2. This question is a two-part type question. So this question is a difficult level, is a type question. It is a analyzing and applying question. So this is where you need to have really a good foundation of the signs and symptoms of the acid-base imbalances. And even if you didn't know the signs and symptoms, you can kind of figure out what's going on, what type of acid-base imbalance with the clues that are given within the question itself. So if you have an understanding of metabolic issues, acid-base imbalances, you're going to see wording in the question. If it's metabolic, you'll see nausea, diarrhea, vomiting, or anything like that. You would see any like kidney issues like DKA, or you would see something with potassium like levels that's specific. Some metabolic acid imbalances could cause either high or low potassium levels. So that having a good foundation understanding of that you would actually be able to recognize and identify the clues that are given in that question based on that. Respiratory, you're going to see illnesses like, any respiratory illness like pneumonia or COPD, or if they're giving vital signs that have irregular, abnormal vital signs that are geared towards respiratory, it's going to be a respiratory acid-base imbalance. You just got to identify which is if it's going to be acidosis or alkalosis. So let's look at this question here. We're going to look at the clues. Your clues are going to be your vital signs. So look at anything that's abnormal that's in these type of questions. What is abnormal? I mean, obviously there's low blood pressure. The rate is tachycardic as well. And then we have the wording. It actually says respiratory rate of 30. Is that normal? No, it's not. So the word that means is telling me it's the respirations are fast. And what happens with fast respirations? What happens to the CO2? You're blowing out the CO2. That means it's going to be alkalotic. So remember, when there's a low CO2, if it's below 35, it's going to be alkalotic. If you're actually slow respirations and you're apneic, or you got COPD, or you're obtunded or something like that, or anesthesia, you're going to actually have a low respiration. You're at risk for acidosis because you're keeping in that CO2. You're not blowing out that CO2. So with these clues that are even just giving it says right here, respiratory rate. We're thinking respiratory. It's going to be respiratory alkalosis. Um, so now that we figured out what the acid-base imbalance is, we're going to look at the pH. This is how you're going to actually narrow down your selection and kind of get down to two questions, right? To select from. You're going to look at the pH. So when you respiratory alkalosis, the pH is going to be what? The pHs will be high, because remember, wherever the pH aligns with, that's what your acid-base imbalance is. So that's the primary. That's a good indicator of seeing if it's going to be acid or alkalotic. So we are looking at this. So these two right here, we're going to automatically eliminate. We're going to eliminate A and B. So we don't even have to look at this now because we know this is going to be respiratory alkalosis. So now we're looking at the pH here. So we know this right here. So this is going to be respiratory. So we're going to eliminate the bicarb because we know it's not that anymore. That's not metabolic. So you can even actually eliminate that. So it will make it easier to actually just focus on these values right here. Okay, so what aligns with alkalosis? So the CO2 is low here. So the pH is high, and then the CO2 is low. That equals respiratory alkalosis. So the answer is C. That's how you actually can eliminate that. So that's why I can't, I'm going to have a question like this again on the finals. So I did give you handouts on the signs and symptoms of each metabolic acid-base imbalance. Question. I'll give you a question. So it's really good to figure out this, to analyze and try to figure out what is the question asking you. Look at the clues in the question. Look at the abnormal in the question. Because when you see the abnormal in the question, that's going to actually give you an idea whether it's going to be metabolic or respiratory. So that's how you can figure out with that type of question there. Okay, so let's look at this question here. So again, we're looking at the clues within the question, right? We're looking at the abnormals. So those are going to be our clues that are going to lead up to figure out whether it's going to be metabolic or it's going to be respiratory. So let's look at the signs and symptoms. This is abnormal, right? Severe vomiting, diarrhea, and nausea. Those are abnormal signs and symptoms, right? Then we have the potassium level right here. That's low, so that's hypokalemia here. And then we have a low blood pressure, which is hypotension. So we have those three clues and what correlates with that. So there's nowhere near that says any that's given us clues that are leading up to respiratory. There's no respiratory signs and symptoms there. There's no illnesses that actually are respiratory chronic illnesses like pneumonia. So this is going to tell me this is metabolic. So this is where our critical thinking actually comes into play here with this type of question. So we are trying to analyze this question, and once we analyze this question, we're going to apply it with the selection, try to figure out what blood gases aligned with our symptoms and within that question. So this is going to be metabolic alkalosis, mind you. So just remember that diarrhea and vomiting can lead to an imbalance in your potassium levels and affecting that your acid-base imbalances, which is the pH. So potassium is a key electrolyte that helps regulate fluid balance, nerve function, and muscle contractions. So here's how potassium interacts with the pH balance during episodes. And this is kind of little tidbit information here during vomiting and diarrhea. So this is what happens to your potassium. So when you lose potassium via like diarrhea or vomiting, it causes the body to lose significant amounts of fluids, and this is including potassium. So potassium is lost through the GI tract, and the depletion can lead to hypokalemia, which is low potassium levels in the blood. So the impact on pH balance, so when we look at acidosis, vomiting causes a loss of stomach acid, which is hydrochloric acid. So that's what happens with that. So you're losing that acid in your stomach by GI loss. So which can lead to alkalotic, which is higher pH condition called metabolic alkalosis. So this can occur as the body tries to compensate for the loss of acid. So alkalosis and potassium. So when alkalosis develops, potassium tends to shift from the blood into the cells in an attempt to balance out the pH. So this shift can worsen the low potassium levels in the blood, which is hypokalemia. And this can lead to muscle weakness, cramping, and fatigue. So that's the explanation to that. That's why as to why you would see a low potassium lab value. So now that we figure this is going to be metabolic alkalosis, this is how you can do, like again, we're doing the rule out method here. So let's look at the pH. So alkalosis, we know the pH is going to be high because acidosis, the pH is going to be low. So remember that. So we're ruling out, we're eliminating A and B because we already know this is not going to be, the pH is not going to be low for that because we know it's alkalosis. So the pH would be high. So this kind of leaves us to C and D. Again, we know that this is metabolic, so we can also eliminate the CO2. This actually narrows it down. It gives us a really good to kind of simplify it and that's how you can simplify it and really narrow it down to what between the two. And then right here, we're not looking at our pH. Now let's look at our bicarb. Okay, this is where you need to know your normals, right? So the bicarb, normal bicarb is 22 to 26. So this is normal. So our answer is going to be D. So this is going to be metabolic alkalosis. If you really want to check your answer, you can do the tic-tac-toe method again, as you can actually see what if it actually aligns with that. So we want to know that the pH is always going to align with the imbalance of metabolic or respiratory. So the respiratory or the metabolic is always going to align. So whether either one that aligns with pH is what your acid-base imbalance is going to be. And this is how you actually do it. So the pH is alkalotic, it's going to be base, right? And we're looking at D answer. And then we have our HCO3, which is a base. Right? This is a little bit elevated because it's 35 to, it's usually 30, so that's normal. So it's 35 to 45, so the actually CO2 is normal. And right here, this is how you know, this is how you figure out, that's your answer. It's metabolic alkalosis. So that's how you can break it down and figure out. It's a lot about critical thinking. It's a lot about analyzing, and this is applying. So this is a difficult level question. I will have a question like this on the final. So just get to be familiar with the signs and symptoms on your on the PowerPoints and the study guides that I have given. Okay, let's try another question, just one more, and then we'll move forward onto the integumentary and the other content that I was going to cover. Again, let's look at the clues. Be familiar. You're looking at the abnormals. All right. So the abnormal in this question that it's providing me is exacerbation of COPD, shortness of breath with headaches. And the patient also, he reported he increased his home O2 from 2 liters to 6.5 liters for the past 2 days. So what does that tell you with that? What correlates with COPD? What happens with the CO2 with people who have COPD? They actually they retain CO2. When they have an exacerbation, that means he's shortness of breath. He increased his oxygen levels. Normally, the max cutoff is 4 liters when we people with COPD because they retain CO2, and we don't want them to retain CO2. And the more oxygen they receive, they're at higher risk for elevated levels of CO2. So we don't want them to go beyond 4 liters. So this is something that Professor Gallagher, I'm sure, has covered in her lecture on the respiratory content. And also, I'm sure she covered the ABGs and how to analyze them and figure out what's going on as well. So the COPD, they're retainers. So we already know that. So we know that CO2 is most likely going to be high. So a high level of CO2 indicates acidosis. So this would be respiratory acidosis. Now that you've figured out what's going on with this patient, that's based on the signs and symptoms that were given and provided in this question. Don't, like I said, don't look beyond the question. Just look within the scope of the question. Look for the abnormals, vital signs, or anything abnormal in that question, and just pull that out and try to figure out what's going on with that patient. That's how you can do that. So we already know it's going to be acidotic. So the pH is going to be what? The pH will be low. So this is an easy one because really right here, you're looking at the pH. Let's look at the pH here. So that's actually going to figure out, because respiratory acidosis, like I said, you're going to have a low pH. If it was alkalosis, it would have a high pH. So we're eliminating the pH that has a high level, that has a high pH. So we're right here, we already eliminated B, C, and D. So guess what? We just did a lot of like rule out, and we just narrowed it down right to the answer. And it's A. That's respiratory acidosis. So and even if you want to use the tic-tac-toe method, like we showed on the previous slide of the question there, you can use that to kind of confirm, to check, double check your answer. Or you could do the Rome method. There's another Rome method where when you see Rome, so this means right here it's just covering, this means it's the respiratory. The arrows are always going to be opposite. So obviously this person has respiratory acidosis, so the arrows are opposite. And then we have the metabolic. So metabolic means metabolic is equal. So respiratory is opposite, metabolic is going to be equal. So if you had metabolic acidosis, you're going to have, so metabolic acidosis will have double arrows down. Metabolic alkalosis, you're going to have double arrows up. So you can actually even check it on that way too. Or the tic-tac-toe method. So here we go. We got that. And then this is going to be, and like I said, the pH is always going to be in the driver's seat. So wherever the respiratory or bicarb or the metabolic is going to, so with whichever one that falls underneath the pH, whichever follows the pH, that is going to be your acid-base imbalance. So this is where this is based on my lecture and in my PowerPoints. So these, and also derived from the chapter. So this is exactly where I got this information from. So this is pretty much what I just wanted to show you as far as what type of questions and just kind of knowing the signs and symptoms. I know I did say in class in my lecture to know the causes and the signs and symptoms of these acid-base imbalances. So I would recommend you to go over and review this again. More than happy to, if you utilize our office hours, more than happy to go over this with you again. Just contact me if you need to review this closer to the final exam. So this is an example of, this is pretty much what the study guide I have handed out to you guys during lecture, and I also have it on Moodle under my content for fluid and electrolytes and acid-base imbalances with the PowerPoints. So this is something that you guys can look over. I know this is like these type of questions that we provided that I went over previous slides. But this is something that you already have a foundation of knowledge of. You have a foundation of knowledge of diabetes ketoacidosis. I know this because Professor Foos went over this with you. I know this because she also discussed the acid-base imbalances that go along with that, which would be metabolic acidosis. Metabolic alkalosis, I know I went over that with you as well when we went in acid-base. Anything when we have GI losses like diarrhea, vomiting and stuff like that. I did explain it really well with the other with that question there. So just if you need to go back to that one, go with the metabolic type question. So go review that as well. But these are all things that we all discussed and we went over in our lectures, and we went over them, and we actually provided you study material, and it's in our PowerPoints. So I really do highly recommend to review those. But I know you guys know this. It's just kind of figuring out, these are different types of questions that you need to get used to. But this is where you got to pull in that knowledge that you already have, and that's where you actually got to apply it into these questions. Okay, moving on to fluid and electrolytes. This is more kind of touching base on magnesium, because that's one of the questions that was more focused on hypomagnesemia. So this is something, the next slide will cover that. So this is one of the questions that was on the exam. It was similar questions on exam 2. And I'm going to be using this as my reteach. And this is more about the signs and symptoms, identifying signs and symptoms of the fluid and electrolytes imbalances. This question, the answers would be B, twitches and hyperreflexia. Just kind of having an idea of what magnesium does to the system, and I will explain that in the upcoming slide. So magnesium, if you kind of look at it, if you kind of look at what the primary functions of what these electrolytes do and what magnesium does, you would recognize, you would kind of see the differences of hypo and hyper versus hyper magnesium in the body system and what it does to the body. So when you have a good foundation of what the functions are of these electrolytes, it will actually give you, help you identify the signs and symptoms of hypo versus hyper electrolyte imbalance. So I'm going to just kind of discuss magnesium. So magnesium has many key functions that what it does to the body. One function is it's crucial for maintaining healthy bones. It helps regulate calcium levels and supports bone formation. It also plays a role in converting food into energy by helping enzymes in the body to produce ATP, which is adenosine triphosphate, which is a primary energy carrier. So that's why when you see low magnesium levels in people who are really malnourished, nourished, or alcoholism or chronic alcoholism. It also helps with muscle contraction and relaxation. So it works with calcium to regulate muscle function and prevent cramps or spasms. It's also involved in transmitting nerve signals and maintaining a proper balance of electrolytes, which is vital for nerve function. It supports healthy heart by helping regulate the rhythm of the heart by supporting blood pressure as well. So this is where you would see like a lot of dysrhythmias with low magnesium levels, which the pretty much the telltale sign is like torsades de pointes, which is polymorphic ventricular tachycardia. So that's where you would see with low magnesium levels. The treatment for that, there's my dog. She sees another dog out the window. So there's that. She's a diva. Let's ignore her. So that's what it does with the heart function with that. It's also involved in synthesis of protein and the creation of DNA and RNA, which are crucial for cell growth and repair. It also plays a really good role in maintaining normal blood sugar levels and help prevent insulin resistance. It also helps regulates neurotransmitters and may have a calming effect. So if you take more magnesium or certain magnesium, it helps with the relaxation. It helps support mood and mental well-being. And also it aids in body's detoxification processes by supporting the liver and breaking down toxins. So those are the main functions, many of the functions of magnesium that what it does in your body. So this is where you would actually kind of go back to the electrolytes and just kind of, get a good foundation of, what are the main functions of these electrolytes. And that's where you can kind of recognize if the signs and symptoms of hyper versus hypo electrolyte imbalances. Again, this was also from my PowerPoint. So I just wanted to give that to you guys for the view. So if this is something for you guys to review the electrolytes, get a good concrete understanding of what these electrolytes do to the body. Another here. So here's the one portion of the integumentary, which was a question that was on exam 2, which was basically the treatment. So what is pediculosis? It is commonly known as lice infestation that can affect the head, body, or anywhere that is any hair that's located in the body, which could be the pubic area. Treatment typically involves medicated shampoos or lotions containing substances like pyrethrins or permethrin, along with other thorough cleaning and clothing and bedding. So that's what that is. Um, and the symptoms will usually include like intense itching, especially in an affected area that is, which is a common symptom. It's also called usually lice and nits. You may see lice in adults and nymphs or nits, which is lice eggs on the scalp or hair of the body. Like I said, the treatment is the medicated shampoos and lotions. Sometimes they can be over-the-counter prescription or prescription shampoos and lotions containing pyrethrins or permethrin or other active ingredients that are used to kill lice. And I think, like I said, you want for knit combs as well. These combs can help remove nits from hair and also thorough cleaning of. This is what you would want to educate your clients that wash the clothing, bedding, and towels in hot water and vacuum to prevent the spread of lice. And also, retreatment may be necessary after 7 to 10 days to ensure that no eggs have survived. So this is right here is from my PowerPoint slide. This was the treatment of and interventions as far as of pediculosis. So this was one of the questions on exam 2 that kind of like, this is why I'm having it on the reteach, because some people had this wrong. I think because the explanation was in the notes on one of the PowerPoint slides, which you will be seeing shortly. So methotrexate is a medication commonly used to treat various conditions, like including rheumatoid arthritis, certain cancers, severe psoriasis, and other autoimmune diseases. It also works by inhibiting the activity of enzymes involved in cell division and inflammation, and this helps reduce abnormal growth of cells or immune system activity, because psoriasis, as we know, is an autoimmune issue as well. It's a proliferation of overgrowth of skin cells, which cause it where the plaquing of the skin and overgrowth of that. So that's why again, method is used for cancer treatment. Usually it's used in chemotherapy for cancers like leukemia, lymphoma, or breast cancer. Also autoimmune diseases, which is like rheumatoid arthritis, lupus, or psoriasis. And also ectopic pregnancy. Methotrexate can be used to treat ectopic pregnancy by stopping the growth of the embryo. And there's usually different forms of methotrexate. It can be taken as a pill or as an injection or IV. It depends on the condition that's being treated. These side effects include nausea, fatigue, hair loss, mouth sores, liver toxicity. Long-term use requires regular monitoring of blood work, especially the liver and kidney function. The precautions that you need to take with this medication are individuals with like liver disease, kidney disease, or low blood counts. So that's why with cell blood CBC, kidney functions and liver functions, liver enzymes are monitored routinely throughout the treatment. So that's the explanation of that medication. Again, this was one of the slides in my PowerPoint. If you look into, and I believe I did post that on Moodle with that with my version with the notes. So look at the in the notes on the slide, and it kind of gives a further explanation, a detailed explanation of the methotrexate. And this is what you would see when you look into the notes of that PowerPoint slide that I was discussing previously. So again, if you guys have any questions, or if you need to utilize office hours to have us go over the content with you, be more than happy to do so. If you want to create like a good study group or whatever, utilize our office hours. They're for you. So our office hours are also posted on Moodle. So that will give you an idea. Just reach out to us, email us, set up an appointment. It doesn't have to be just one student. If you guys want to, have a group of students, be more than happy to create a study session for you guys to utilize those hours. They are for you to use, So, if you don't use them, I'm just sitting there twiddling my thumbs. I'm not really, but I mean, just, those offers, they're for you. And so I'd be more than happy to set up a good study group for you guys. Don't wait last minute. If you have any questions of our content, please contact us and reach out to us.